Thank you. Thank you for coming here this morning to talk to us. And I have to say, I find this whole process very frustrating. Least of all, the rulings that we get, that we can't talk about this and we can't talk about that, and that's subject to legal action. And this is not. It really does hamper us in doing our job and trying to scrutinise what's going on. And I notice you're nodding your head. I'm sure you're used to this, that you get plenty of it. Legalities hamper the truth coming out, and in this case I think we're going to have to find a way to get at the truth. First of all, I want to say that I found your report alarming because it sort of skirts around a number of key issues that in one sense you're saying is jumping out at you, i.e. the privatised nature, the largely privatised nature of our nursing home sector, the care of our elderly being the subject of lots of profits for lots of companies. However, at no stage in your report do you point to that as being a problem. One of the starkest figures from everything I have come across is that 56% of all deaths during COVID took place in nursing homes, and that setting was only 0.65% of the total living population. And that's why I think that this alarming figure and the lack of pointing the finger at what has gone on means that we do need to have a public inquiry into everything that happened. And I have been adamant that I want that inquiry to take place into examining all the deaths and all the decisions taken in each case, and particularly not to move residents to acute hospital settings. Now, in that light, I want to mention the grandmother of Florence O'Shaughnessy, who has written to us all, and she was taken care of in a nursing home in Dublin, which I'm not allowed to mention.
You know that we're not here to talk about individual cases. If there's a particular practice...
Chairperson, I have 5 minutes and I'm not going to be hampered in what I'm trying to do with this committee. I'm raising this for a reason.
Just as you're entrusted with representing your constituents, I'm entrusted with chairing this committee, and I'm not going to allow you to raise individual cases.
So are you telling me I have to shut up now?
No, I've never told you to shut up at all, nor will I. What I am saying is that we're not here to discuss named institutions or individual cases. You are perhaps right.
I'm using it as an example. I am not using it.
You have called for a statutory inquiry. A statutory inquiry, depending on its terms of reference, could be empowered to look at every single case or named cases, such as the one that you've just named. But it is not the role of this committee to do so.
I am using it as an example, Chair, and I stand over my right to use examples here to exemplify the crisis we are facing.
I have stated from the outset, Deputy Smith, that I have no problem with you using examples. I have a problem with you naming people. If there's a particular issue that you want to raise, you can raise it, but you're not, and I would ask you
I'll move
to
on. I have a specific question I want to ask. I'll move on because I know you'll take this argument out of the very limited time that I'm allocated.
Well, I mean, all I can do is share this as fairly as I can.
On the 13th of March, you ceased inspections, regular monitoring and inspections of nursing homes. That also happens to be the date that you were first notified of a death from COVID in nursing homes. And it was said earlier on by Mary Dunyan that we were all learning, everybody was learning about this pandemic and how we should handle it. But you seem to have learned very quickly on the same date that you got notification of a death, that now is the date that we don't go in and inspect nursing homes anymore. And there were no inspections, if my understanding is correct, there were no inspections and no monitoring taking place between March, April, May. That was when, and if you look at the graph of the unexpected deaths in nursing homes, it's very graphic how during that period it spiked out of all control. It was absolutely startling, and we're all aware of it through the news media reports, etc. But I do need to ask you why you took such a sudden, rapid decision to end all inspections, all monitoring inspections of nursing homes on the first day that you heard of a death in a nursing home. I think it was inadequate, I think it was inappropriate. Inspectors could have gone in there dressed in PPE, dressed in spacesuits if necessary, when we expected staff and others to go in there and carry out their jobs with little or no PPE, with instructions that they shouldn't wear masks until they were symptomatic. We did not have the oversight of a body that this state depends on to ensure that things were being done in a correct way. So the fact remains that those inspections didn't take place, and we now have hundreds of families left in distress, wanting to know exactly what happened to their loved ones. They know they died, but they don't know in what circumstances, and they don't know what was given to them in terms of pain relief, in terms of distress relief, whether they could have been transferred to a hospital. We paid millions on capacity in private hospitals, which were largely left empty during the pandemic, but we don't seem to have taken the care to shift elderly people to a hospital setting where they could have at least died with more dignity, with less pain and less distress. So I think all of that needs to be investigated. And since I'm not allowed to mention names or families, it does actually take from the strength of the evidence that I wanted to give here today to try and bring alarm to both you and the public and the government that we absolutely need a public inquiry. The second thing I'd like you to comment on is the critique of the privatisation of the nursing home sector, because you do say in your report that the issues around the COVID in the private nursing home sector throws into sharp relief the lessons we have to learn and the impact on nursing homes. And you do say it exposes a fundamental weakness in privatisation of the nursing homes. But at no stage do you draw conclusions from that. And I think the second conclusion that we need to start moving towards, and this committee is going to have to deal with it sooner rather than later, is that this state needs to ensure that the provision of long-term care of our elderly is brought under public control, and that oversight and legislation which will arm you and others is required to end what's happening here and to develop a nursing home sector that's accountable and directly run by our health services.
Thank you.
And I just want to comment on that, please.
Yeah, no, well, I mean, I'll allow it. It's overtime, but I'd certainly allow it given the importance of what you've raised. Yeah.
Deputy, again, thanks for your questions. Can I maybe take the question in relation to the cessation of inspections in the first instance? As my colleague Mary Dunyan has said, that decision was taken in line with public health advice, and indeed it's a well-established practice that inspectors do not go into homes where there are specific outbreaks. Certainly, we were learning, and one of the places that we were learning from was from our fellow regulatory bodies right across these islands, but also across Europe as well. We're part of a forum and stayed very, very close to the sorts of practices that the regulators were undertaking, within those specific jurisdictions. And my colleagues would be happy as well to detail the level and the very significant level of supports, advice and contact that we maintained throughout the early days of the pandemic and since. And really just to say as well, as an organisation, in those early days of the pandemic, we engaged in a very significant range of other activities in support of the national effort. And that included the development of evidence summaries and evidence synthesis for the National Public Health Emergency Team, of which HICWA has been and is a member. The development of guidance, the transfer of staff to the HPSC who had experience in surveillance science and guideline development, the development of online infection prevention control tools, of which recently we've seen, which was published recently, and we've seen an uptake of somewhere in the region of 4,800 contacts with that particular training tool in the last 2 weeks. So a very, very significant level of intervention and support to the national effort. I'll pass to my colleague just to answer the rest of your question.
I'll just take the second point, Deputy Smith, and you're correct. 80% of nursing homes are privately provided, and there is, and we welcome that there is going to be examination of the policy around residential services in line with Sloan to Care. But in the context of the inspections, I'll hand over to my colleague Ms Cliff to go through that from the 13th of March.
I think in fairness to Deputy Smith, her point was that the fact that 80% are privately provided was problematic. Was there a higher incidence of deaths in private nursing homes?
That's not my question.
Sorry, so is your objection to the fact that 80% are privately owned related to COVID, or is it a general ideological objection?
I'm stating that the report omitted to make any comment on the privatising.
Okay, well, I'm asking Ms Dunyan to make a comment.
Yeah.
Was there a higher incidence? Obviously, 80% of patients, or residents rather, excuse me, are in nursing homes are in private care, but was per capita, was there a greater incidence of deaths or unexplained deaths in private nursing homes over public ones? Not in general terms, because obviously there are 4 times more residents in private nursing homes than state-owned ones, but what was the number of deaths or unexplained deaths greater than that proportion or ratio?
Chair, that was not my question. She was about to answer the question I asked. So.
It's my question. And don't worry, I will allow her to answer the question. Ms Dunyan.
So as I said there, I would acknowledge and agree with Deputy Smith in that there is a higher percentage in private provision, and that policy is going to be reviewed, and that has been the indication, and the current model is based on national policy. So therefore it requires a change if that is the direction of travel that government decides.
My question is, 80% of patients, residents, sorry, I consistently use the word incorrectly and I apologise. 80% of residents in nursing homes are resident in private nursing homes. Was the number of deaths disproportionate in privately run nursing homes over HSE or other state-run entities?
I would not say it was disproportionate because COVID didn't have outbreaks all over the country. There was regional distribution. So I would not be able to give an accurate answer of that, and I think that really would be for the Health Protection Surveillance Centre to actually analyse the data and provide that answer.
Thank you. Sorry, continue with the answers that you're...
So then in the context of Ms Cliff will cover the other question.
What we can say is that in respect of the notifications we received about COVID-positive residents and staff, that really nearly broke down 80-20% in line with the breakdown of the makeup of the sector. So, for instance, you had a total of 2,617 residents notified to us as having contracted COVID-19, and 2,000 of those were in the private sector and 545 in the public sector. And by public, I mean the centres that are run by the HSE or that are funded by the HSE through Section 38 or 39 arrangements. And similar numbers are available for staff. And if you stand back another level and look at the total number of centres that were impacted by COVID, it's 77% of those centres were private and 23% of those centres were public. So the incidence really broke down in line with the makeup of the sector. But Mary is right when she says COVID in the nursing homes followed COVID in the general population. And that's why we saw nursing homes in key areas with higher levels of COVID than you did, say, down in Cork, Kerry and that region of the country. Okay,
but I suppose I appreciate it's not the question Deputy Smith wanted answered, but there's no reason to believe that privately owned or run nursing homes fared any worse than the HSE run or owned or public owned or run nursing homes with regard to COVID.
Residents and actual deaths attributed to COVID, we don't have the definitive data on that. That is held by the HPSC, and it may well be something that will be looked at in the future.
From the figures you've given, there's certainly no indication.
The incidents were breaking down along the same lines as the makeup of the sector.
Thank you. Thanks very much.